I'm Lori Latvis, and I'm presenting on the theoretical framework of ethnography. First, I will provide a brief overview of ethnography and then cover the origin, evolution, prominent contributors, two applications in healthcare management, limitations, and then I'll provide a summary of the salient points on ethnography. As a brief overview, while there are many definitions of ethnography, in simple terms, it's the study of culture. Anthropology ethnography is a research process where the researcher does ethnography in the field and produces a product, which is known as the reported study. In short, ethnography fieldwork is aimed at finding out things that do not seem important but belong to the implicit structures of people's lives. The intent of ethnographic research is to obtain a holistic picture of the subject of the study, emphasizing on portraying the everyday experiences of individuals by observing and interviewing them and relevant others. The word ethnos comes from Greek meaning people and graphy meaning study. The features of ethnography include that it is empirical, inductive, holistic, descriptive, discovery-oriented, and it seeks to understand people of a culture. Data collection for ethnography research takes place in naturally occurring settings, is a long-term process, comes in many forms, and involves researchers immersing themselves in the cultural environment. Data analysis is rich in description, and the ethnographer becomes a storyteller when interpreting the data. Rich depiction and vivid detail comprise the final ethnography, so readers sense what it's like to be part of the culture. Ethnography, in its earliest tradition of qualitative inquiry and its origin, is in anthropology, meaning that ethnography is a theoretical framework that contains ontologies, methodologies, and epistemologies positioned within the tradition of anthropology and do not necessarily fit other traditional frameworks. The evolution of ethnography, in the very beginning, anthropologists studied non-literate, primitive, exotic cultures, and findings were used to overcome imperialism and conquering empires. The history of ethnography reveals diverse theoretical and methodological commitments. As time went on, the cornerstone of applied ethnography began involving change efforts, and in the 1980s, understanding culture became central in organizational cultures, with organizational development work with major efforts to change culture of an organization or program. With the advent of the internet and social media, further changes affected ethnography to include observation through video ethnography. And then currently, modern anthropologists apply ethnographic methods to study contemporary society, such as information age culture, the culture of addiction, intercultural marriages, poverty, school, youth culture, and the spread of disease, or otherwise known as ethnoepidemiology. Ethnography is now used to study international relations and global diplomacy, corporate environments, and consumer behavior, including patient experience. Autoethnography is still an emerging approach, which is the study of one's own culture and oneself as part of that culture and its many variations. Critical ethnography grew out of traditional ethnography to examine critical issues and subordinate populations shifting to cultural dominance. The prominent contributors were Bronislaw Malinowski, who was the first to use participant observation to generate anthropological knowledge. While there are many contributors to the field of ethnography, Robert Park and Franz Boas were in addition to Bronislaw Malinowski. Robert Park studied influences of race and people, and Franz Boas studied the Innu people in Canada and cultures of Native Americans. Malinowski advocated the use of charts and tables in analysis and used depictions of everyday action to understand societies. Other contributors to the field of ethnography included Del Hymes, who attempted retrieving the historical roots of ethnographic research and providing firm theoretical grounding for ethnography. Hymes called ethnography a descriptive theory, an approach that was theoretical because it provided description in specific methodological and epistemologically grounded ways. And Dr. Mead proposed that culture plays just as a strong role as biology in influencing adolescent behavior, and Ruth Benedict posited that the purpose of anthropology was to make the world safe for human differences. There were I'm going to talk about two applications in healthcare management, and the first one is using ethnography to study healthcare-associated infection prevention and control. So this one is in helping resolve overall in helping resolve difficult healthcare issues relating to understanding contextual factors, identify personal contexts such as working teams and culture that support or hinder implementation of evidence-based practices, in particular this one for reducing hospital-acquired infections. Hospital-acquired infections are associated with increasing mortality and they generate additional costs. Although much attention has been paid to hospital-acquired infections, they remain a challenge. Ethnography was used to understand the data reports, identify barriers to adherence, explore patient perceptions of isolation practices, and highlight influence of the physical design on infection prevention practices. And then application number 2 was meta-ethnography of adolescents' expectations of their healthcare providers. And in this application, it provides the researcher with an opportunity to see phenomena in terms of others' interpretations and perspectives and gain a more holistic interpretation. In this example, research was conducted using an ethnographic framework that focused on the perspectives of adolescents related to primary healthcare services and to capture a more holistic view of what adolescents as consumers believe that healthcare services should be and what they expected from their healthcare providers. The reason was to determine why adolescent rates of preventive services were decreasing. And this was considered important primarily to identify and address risk-taking behaviors, unhealthy habits, and prevention of injuries contributing to morbidity and mortality in this population. And if they were not receiving their preventive visits, as they were not, then these issues could not be identified. There's several limitations with ethnography studies. And the first is that ethnographers must accumulate knowledge about the methods and the domains that they're interested in, which takes considerable time and training. Sensitivity is involved as the ethnographer is an outsider and must exercise discretion and caution to avoid offending, alienating, or harming those being observed. Negotiating access to field sites and participants can be time-consuming and difficult. Research can involve prolonged time in the field, particularly because building trust with participants that are in the study can take time. And then ethical regulations and informed consent is required from all participants, so that can also be viewed as a limitation. Bias is also a limitation because ethnographers bring their own experience into the research process that can affect when they're asking questions and conducting analysis, and also when reviewing the data. Ethnography relies heavily on storytelling and the presentation of critical incidents, which is inevitably selective and viewed as a weakness by those using scientific approaches such as hypothesis testing and quantification and replication. It's also not considered the gold star. No statistical data is used. However, one could argue that advocacy research, such as the use of ethnography in certain cases, takes longer, but it's stronger and longer lasting as it is a power means of advancing change-oriented agendas. In summary, ethnography contributes to knowledge of the social world. It can open up certain experiences during group research that other research methods fail to cover. There's multiple uses. Ethnography can tap into intuitive and deep human understanding and interpretations of the accounts of those who are being studied, which goes far beyond what quantitative research can do in terms of extracting meanings. Ethnography allows people outside of a culture to learn about its members, practices, motives, understandings, and values. To sum up the value of ethnographic fieldwork, a quote from a reading from Blumert and Jai. Ethnographic fieldwork is aimed at finding out things that are often not seen as important but belong to the implicit structures of people's lives. Asking is very often the worst possible way of trying to find out. Thank you for listening, and please note my references that follow.